And for more, our colleague Mlondi Radebe is on the story. A very good morning to you, Mlondi. What can you tell us at this moment?
Good morning, Desiree. We are at the Durban and Coastal Mental Health Institution here in Durban, where the workers this morning, they blockaded the entrance, they blockaded the management from entering the building. They're saying that they are sick and tired about the allegations that are placed by many news organizations in relation to the allegations of staff being not paid, because they also claim that they were not paid in time this last month until they only received their salaries today. Just to recap, Desiree, about this institution, SABC has been reporting on this institution since 2017, where workers and the people who are inside the institution were complaining about the stale food they receive, the abuse and the sexual abuse that was happening in the institution. But since that time, there was no thorough investigation that was done that maybe someone was fired in the institution. But instead, they say that the institution is investigating the whistleblower that was giving the members of the media those kinds of stories. But next to me is Lezel Mool, who will briefly tell us about the issues and why this morning they decided to blockade this entrance. Lizel, thank you very much for your time. Briefly about the institution, we understand that you are also part of the board.
So the staff called me this morning to say that they were going to protest. They are concerned that another life esidimeni is going to happen right here at DCMH, and that's what we're trying to prevent. You know, in the past, service providers haven't been paid because there's not enough money. The roofs are leaking. When I first came here, I mean, some of our users were lying in their own urine. So yeah, my heart's broken. Since then, obviously, we've worked hard to try and fix things, but, you know, there's been an investigation from the Department of Health. We're waiting for that report to see, you know, where is the problem. Till we know that, there's not much we can do, but we are asking you, the communities, to come and help, you know. Our mental health care users, they need your help, you know. They can't speak for themselves, we have to speak for them.
There have been these allegations of abuse and sexual abuse. What is the investigation so far?
So it's a difficult one. Mental health care users can't speak for themselves, and therefore also in the law can't speak for themselves. So a psychiatrist would need to comment on this, but we are waiting for the channels to be followed so that this person can be moved to another facility where they are better managed. We are, I mean, that's why I think the staff are here. They're begging DOH and DSD to intervene in circumstances like this, because there's not much we can do. You know, you can't lock up someone because they don't understand what's happening. You know, you must understand in their mind, they're not like you and me who can understand the circumstances. So this is why we need to speak for them and also protect their victims, you know. They also don't understand what's happening to them. Imagine if you don't understand, you know, and someone rapes you. It's even worse, you know. As a woman, being raped is one thing, but imagine you don't even understand what that person has done to you. So this is where we're asking the public to ask, you know, what is happening with people like this? And it's not just at this institution, it's happening all over the world. And yeah, it's up to us to stand up and say no.
The other issue is the funding of this institution. They also receive a grant from the Department of Social Development. So how come the institution is saying that they don't have funds in relation to paying staff and other supply chain?
So as an MPO, we are obviously lucky that Department of Health and Department of Social Development fund us, and they do give us a lot of money. So in this case, we can't really blame the government because they've done their part. Obviously, we need to then find more funders, but because financial records haven't been kept well, we no longer have any private donations from trusts, etc. And then obviously, if you overspend, you've got a problem, you know. If you've only got a budget of X amount, but you're spending X times 2, you've got a problem, and that's where we're at, and that's why service providers have left, because they haven't been paid. I can understand. Some of these people come from previously disadvantaged homes. They don't know how to feed their family at night. Can you imagine after 3 months you're going home and saying to your child, sorry, no dinner for you? I can understand. I mean, my heart breaks for some of these women. Some of these men, they come to work without pay. I don't know, like, you want to cry for them. What are they telling their children at home?
So what's the way forward so far?
We're asking DOH to give us the report. In the report, hopefully, I don't know, I haven't seen it, the report will hopefully give us a way forward, a way to fix what's wrong, so that we can fix this place. I believe it can be fixed. We've spent a lot of time. You saw our staff driving past here just now. They fixed the roof here. We're fixing the swimming pool. We're fixing as much as we can, but we need the community to step together. So I think there is hope, but without that report, there's nothing we can do.
Thank you very much, ma'am, for your time.
Thank you so much.
There's also who's the was part of this protest. Thank you very much, sir. Can you have your names for our record?
Okay, my name is Leon Maas and I represent the Jonah Vaughan Parents Association in Amanzimtoti.
Briefly about this issue, because we understand that you were part of this protest. What is it? Why are you decided to join the protest? And especially because there's these allegations about the whistleblowers that are being investigated.
I don't know if it's allegations. I wouldn't call it allegations. I mean, if one looks at the bank statement, you'll see it's not allegations. And first, can I say, I've been part of Durban and Coastal Mental Health, or I've been associated with them for the past 45 years. I did have the privilege of serving on the board, the governing board, as a parent representative for 10 years. During my stay on the board, it ran like a well-oiled machine. In about October 2019, the board was hijacked and a new board took over. And sadly, things have deteriorated very, very badly since then. As I said once before, check the bank balance. It's through misappropriating funds and getting the wrong service providers in who actually belong to you, and you pay them extravagant wages. Furthermore, Lisa mentioned about the abuse and the raping and stuff like that. May I add that my daughter, who's now 54, she lost an eye through a care worker who lost her temper whilst changing her nappy. No steps were ever taken to say sorry or anything like that. This child now lives with one eye because of the abuse that she received through care workers who are not well trained and don't belong to unions, or actually don't know who they're working for. At that time it was a company called Flowline. Not Flowline, the name skipped me now. I can't remember the company's name, but you know, nobody seems to know what's going on. How can you take somebody out of the laundry and put them in charge of a dormitory at night when they're not qualified to do so? You know, I just feel that the board has not done a good job at all. There's too much money being stolen, and one has to do something about it, or we're going to find the life best in any situation here as well. As far as the Jonah Vaughan home goes, that's around in Amanzimtoti. We have 84 residents there. One has to visit there to see the way this country should look after these homes for the challenged people in our country.
Thank you very much for your time. There was also the person that is concerned about the state of this institution. I will just ask my colleague Ndabezinhle Khumalo just to show that also the workers, they just sitting outside as we speak, because they've protested. They managed to blockade the management from entering the premises, even though they were accompanied by the police officers. But it ended up with the management leaving the institution. We couldn't get the comment from them, but for now we'll keep an eye on this story. Back to you in studio, Desiree.
Mlondi, thank you so much for bringing us up to speed, but would like to request that when we come to you for a follow-up crossing, perhaps we could get word from management about what they're doing about the situation. Mlondi Radebe there for you, and we will get back to him as soon as he has some new developments for us.